Hello, my name is Anthony Moorman. I'm a researcher based at Newcastle University, where I'm a professor of genetic epidemiology. And the speciality of my research is acute lymphoblastic leukemia, and I've been researching that for around 30 years now. The question I've been asked to talk to you about is the factors affecting survivorship in acute lymphoblastic leukemia. This is a very broad topic and consists of really determining what patients will survive acute lymphoblastic leukemia, and then the kind of longer and more complicated question of the quality of life for those survivors. So in terms of the patients that will survive acute lymphoblastic leukemia, of course, all patients must receive effective chemotherapy up front that is tailored to their particular type of leukemia. And this is very important to ensure that patients are not overtreated or undertreated to minimize the risk of relapse and long-term survivorship. So many factors play into whether or not a patient will respond well and effectively to their therapy and become a long-term survivor. Age is a very important risk factor. Sex plays a part as well, but also the two most important ones really are the genetic profile of the individual leukemia, and this varies from one patient to another, and also their individual treatment response. And both these factors, treatment response, genetics, age, and sex, are routinely used by clinicians treating acute lymphoblastic leukemia in order to put patients on particular treatment pathways that are optimal for their particular type of leukemia. And this is to ensure, as I mentioned before, that they receive the right amount of chemotherapy so that they have the lowest possible risk of relapse. Now, obviously, the therapy for acute lymphoblastic leukemia is very long. In children, it lasts 2 or 3 years. In adults, it's bordering on 2 years. So the amount of chemotherapy that each individual patient receives is substantial. And there are always going to be side effects to receiving that amount of chemotherapy. And these side effects can be immediate sometimes, they can be medium, and they can be long-term. But really, it's the long-term ones that affect the quality of life of patients who have survived their acute lymphoblastic leukemia. And this is really important because some of these can be mild and not really affect the patient's long-term quality of life, but some can be extremely debilitating. And it's kind of obvious to say that the more chemotherapy a patient receives in their frontline therapy, the more likely they are to have long-term side effects. And this has been proven by many studies over the years. But of course, it is a balance because you have to give chemotherapy in order to treat the leukemia and turn the patient from a patient into a long-term survivor. So it's very much a balancing act. A lot of work over the past couple of decades have focused on specific drugs causing specific long-term side effects. And many of these are kind of like the obvious ones to medical professionals. And largely those drugs have either been eliminated from the frontline treatment protocols or reduced to the absolute minimum. So a lot of kind of the easy questions have been addressed in terms of quality of life. But of course, moving forward, we have to think about how the treatment regimes that we are delivering today are going to affect patients long term in the future. And it's worth pointing out here that acute lymphoblastic leukemia is predominantly a disease of childhood. So this is a really major issue because most of the patients will be aged between kind of 2 and 6 years old. So for them, cure and good long-term quality of life means survival of about 70 years, right? 70 plus years. So the issues facing a child with acute lymphoblastic leukemia in terms of survivorship are very different to those facing adults with acute lymphoblastic leukemia who may be 40, 50, 60, and therefore the long-term quality of life is a much shorter period. So what the main factors that will affect kind of long-term quality of life, well, as I mentioned before, will be the amount of treatment to receive, but also it's not necessarily the amount, it's the way, sometimes it's the way it's delivered, and occasionally it's individual drugs. And what researchers are doing now is they're working to collect a large amount of data from patients treated on large number of protocols to see what the difference is. Are there particular protocols that have more long-term toxicity or less long-term toxicity, so that we can then, as we move forward, give the protocols that will obviously have the least amount toxicity for these long-term survivors. The other issue that is very important is the genetic makeup of the individual person. And of course, we know quite a lot about this from just normal drugs. We all know that paracetamol is a very effective painkiller, but there will be some people for whom paracetamol doesn't really seem to cure their headache, whereas others only need to take half a tablet and their headache's completely gone. So there's always a huge variability in how patients respond to individual drugs, such as paracetamol, ibuprofen, etc. And the same is true for chemotherapy. So you can give the same dose of chemotherapy to 10 different patients, but only 2 of them will have long-term side effects. And at the moment, we don't fully understand why that is true. It is likely to be down to the genetic, one of the factors will be the genetic makeup of the individual person and how that individual person processes that drug in their body. And there's a lot of research at the moment that is looking at what's called the germline genetics, a kind of baseline genetic profile of the patient, to see how that impacts long-term survivorship. So in terms of what toxicities can happen, to patients with acute lymphoblastic leukemia who survive long term. Well, this is pretty much everything, right? So it can be everything from cardiotoxicity to nerve damage to problems, having diabetes, to fertility issues, especially if your treatment was when you were a child. So the variety is huge. And what researchers are now doing is, in the kind of modern era where we have these very large clinical trials, particularly in and around trials across multiple different countries, is use that infrastructure to collect very large numbers of patients so that we can try and pin down exactly which are the long-term conditions that are really linked to the individual therapy that patient received sometimes 20, 30 years ago, and which are kind of coincidental. Because of course, as we all know, as everyone ages, we all develop chronic conditions. And this is the same. This is the same for survivors of leukemia and people who have never had leukemia. So we have to try and tease out which one of those chronic conditions that people get in their 50s, 60s, and 70s are really linked to their prior therapy, and which would have just happened normally. So that's quite a lot of work to do. But from a patient's perspective, I think the important thing is that you talk to your individual doctor about the potential long-term side effects of the therapy that you are having. All doctors are very well versed in the long-term side effects. There are programs that patients can engage with to have long-term monitoring, and all patients should engage with that. It's quite regular to have these long-term follow-up clinics where patients are monitored for some of the more prevalent long-term toxicity problems that they have, and certainly within the UK this is kind of fairly well established. The other thing that patients can do is, if they do get invited to be in one of these studies that is about long-term survivorship, it's very important, or it would be very useful if they could partake in these studies, because we really do need a very large number of patients to participate in these studies to get really robust data. And I appreciate that, many patients, after they've had acute lymphoblastic leukemia and the therapy has ended and they've carried on with their lives, they don't necessarily want to revisit their experiences and start going back to the hospitals and stuff. But it is the only way that us as researchers can identify which are the conditions that are really linked to acute lymphoblastic leukemia, and figure out how we can change the therapy so that future patients have far less long-term toxicity. But of course, moving forward, what we all really want is to have a regime that will cure acute lymphoblastic leukemia and have zero side effects. Now, zero side effects is extremely unlikely, but there are many new drugs that are coming onto the market where the initial evidence about their toxicity profile shows that it's much better than our current chemotherapeutic regimes. And this does hold out the promise that some of the newer therapies that we will be looking to treat patients with going forward, in particular blinatumomab, might actually reduce the long-term toxicities and side effects of acute lymphoblastic leukemia therapy in the future. So although the picture is not, completely 100% rosy, I think the future is very good. We are getting much better at treating initial diagnosis of acute lymphoblastic leukemia with much less therapy, which is obviously going to cause less toxicity going forward. And there is an arsenal of new drugs on the horizon that will hopefully take that down even further. Nonetheless, we do have to recognize that the survival of acute lymphoblastic leukemia, particularly in children and young adults, has increased massively over the past 20 years, which is an obvious success. But there are a large number of people now who are survivors of acute lymphoblastic leukemia who have already had that more toxic chemotherapy, maybe 10, 20 years ago. And there is still a need to do research to understand what those issues are and how they can best be dealt with by the healthcare system. And there is research going on about that. So I think that probably wraps up everything that I wanted to say in this initial video. Obviously, it's a very big topic and one could spend a very long time giving a long lecture on this, but hopefully that will be a good starting point for you. Thank you very much for your attention. And please do look back on the No ALL website in future for further updates. Thank you.